problem was that arthritis in that small joint of the shoulder.
Okay.
So I cleaned that up for her. I was able to do it all through the poke holes. So she has 3 poke holes in the shoulder.
Okay.
Her rotator cuff, though, actually did look good, so I didn't have to fix her rotator cuff.
Good.
So basically cleaned up the shoulder and then took that arthritis out. She's going to be very sore here for a while. I mean, she's going to be complaining. But because we didn't have to fix her rotator cuff, if she needs to move that arm some, I would be fine with her moving her arm some.
Okay.
But she is still going to complain to me for quite some time. And you're going to notice a good bit of bruising down the front of this arm. That is okay. That's normal. Okay. She'll have some cramping down the front of this arm, possibly up to 3 months, just from me moving things around a little bit.
Okay.
I don't want her lifting, pushing, or pulling on anything heavy. That's really my main restriction for her. Otherwise, if she wants to wear the sling pretty solid for about a week, I'd be fine with that. Just let everything kind of calm down. And then when I see her and talk to her in about 2 weeks, we'll talk about getting her started in some physical therapy and all that.
Okay. So when's her next appointment?
She should. We gave her a packet when she left the office.
Okay.
It should be in that packet.
Okay,
But,
she's got that.
Yep.
She had some questions.
No, go ahead.
When can she start showering?
2 to 3 days.
Okay. And when does she start the pain meds?
The girls will tell you, but usually about when they get home. If she's not having any pain because she had that block, I would just wait till she starts feeling some tingling and stuff. And the pain medications take about 45 minutes to work.
45 minutes. So if she starts feeling the tingling, then
That means that block's about to wear off.
and take the med then, and it still stay ahead of pain. Okay. And how does she get refills on the meds?
Just call the office.
Okay. Okay.
Does she I already gave her her medications, I believe, didn't I? Does she have them at home?
She picked them up the other day, so
Perfect.
they're at home.
Perfect.
They're ready.
Making sure. Perfect. Anything
Okay.
else?
No, I think that's everything right now. So when you said you removed the arthritis, did you actually,
Remove bone.
you took bone,
So what happens is the
actually
shoulder,
dissected
Oh,
the
yeah.
bone? Okay.
So the shoulder has 2 joints, the big ball and socket, which
Uh-huh.
you can't do anything. Once you get arthritis in that, you replace it. But the small joint, this one here, which is common to get arthritis in, we can actually remove the end of the clavicle or the end of the collarbone. You can remove a piece about that big. It takes your pain away. It'll take a while, but it'll eventually get where she's like, it ain't nothing like it used to be. But you trade the pain. I was telling her, so I'm trying to make sure she remembers. Scar tissue grows into that area,
Right.
so she'll have some snap and crackling when she moves her shoulder. It's nothing bad. You know, people are like, it's making noises now. Well, it ain't like it was before we operated on it, you know. So you trade the pain for a little bit of noise, which most people will be gladly, you know, able to do.
At our age,
I
we
know.
pop and crackle all the
I
time.
know.
And so,
But I think I fixed her problem. Honestly, the rest of her shoulder I thought looked pretty good.
really? Okay, good. Recovery time on this?
I'm telling you, it'll take 3 to 6 months to completely get over it. But,
Uh-huh.
I mean, when I see her back in 2 weeks, I'll start letting her get out of the sling. I'll start her in therapy. And so really about 2 weeks, we'll get the ball kind of pushing forward, you know.
Okay.
But until she looks at me one day and says, I'm glad you did what you did, it may be 6 months, maybe 9 months. You know?
Okay. So therapy would last
I'm going to say maybe 2 months.
2 months? Okay.
She seems pretty motivated. She just got to do it at home. She does it at home. It may not even last that long.
Yeah. I did everything when I had rotator cuff surgery. I did everything they told me to
Yeah.
at home
Yeah.
and at the visits. And I've got full range